Hello, my name is Kevin Klean. I am a board-certified sports medicine fellowship-trained orthopedic surgeon at Crossing Rivers Health. For knee replacements, typically, depending on a patient's lifestyle, work requirements, things like that, most patients I tell them is going to be probably a good 8 to 10 weeks before we get them back to doing most normal things, before they can tolerate a full day at work where they're standing for an extended period of time. Now, if someone works a desk job and things like that, it could be closer to that 4 to 6 week mark. But our orthopedic literature has shown us that after a joint replacement, whether it be a hip replacement or a knee replacement, we usually like you to refrain from driving for at least the first 4 to 6 weeks after surgery, just because it decreases your reaction time. So sometimes we have to make arrangements where someone else can drive a patient to and from work and we can get you back a little bit earlier depending on how you're progressing. But everyone heals at a different rate. So there is no real set time frame where, hey, we're going to have you back by this day. Some people heal a little bit more quickly and they progress more quickly with physical therapy. Some people take a little bit longer. And again, a lot of that has to do with just patient factors and how your body heals and reacts to surgery and things like that too. So we have to take it on a patient by patient basis and kind of progress patients appropriately and get them back safely. Make sure that they can do things that they need to do and we don't put them at risk for having something else bad happen just because we're trying to get them back to work so quickly. And that's something that we work on together as we go with hip replacements, knee replacements, shoulder replacements. We kind of work together in a time frame. And I see, patients after a total joint, I see them at the 2-week post-operative mark. Obviously, I see them while they're in the hospital. Then after they get discharged, then I see them at the 2-week post-operative mark. I see them at the 6-week post-operative mark, and then I see them again at 3 months. And each time we check in, we make sure that they're progressing well with therapy. We check in with their pain and how things are going from that standpoint. We see how they're doing just kind of with their normal activities of daily living. And then we progress patients based on how they're doing in the overall post-operative course. And again, that's going to be different for every patient.